Hello, my name is Ken. I developed cystoid macular edema subsequent to a central retinal vein occlusion in 2002. I'm not a doctor and I have no medical training, so remember to consult your physician without delay when making medical decisions. This video assumes familiarity with the first 4 parts of this video series and does not address many of the topics covered in the introductory video, What is Macular Edema? Macular edema subsequent to a central retinal vein occlusion is the thickening of the centralmost part of the retina due to the accumulation of fluid within the retinal tissue. If, over time, pockets of plasma-derived fluid develop within the retinal tissue, the condition is then referred to as cystoid macular edema. This fluid is often said to accumulate into cysts primarily in the Henle fiber layer and in the internuclear layer. But at least one tissue study reports a pattern of cyst formation in central retinal vein occlusion patients that involves many of the layers of the retina. As these cysts develop, smaller cysts may appear to coalesce into larger cysts, often forming a very large central cyst. The enlargement of these cysts may result in the absence of a foveal indentation, or actually in the formation of a mound at this site. Fluid may also collect underneath the neural retina, causing the neural retina to lift off of the retinal pigment epithelium in the area of the fovea. This is called a serous retinal detachment or serous macular detachment. In an OCT study, Dr. Cattier and fellow researchers found that 56% of the central retinal vein occlusion subjects having macular edema also had a serous retinal detachment. Dr. Ozdemir, in a similar study, found that 81% of patients with central retinal vein occlusion and cystoid macular edema also had a serous retinal detachment. When macular edema remains in place for an extended period of time, the retinal tissues as a whole begin to get thinner. Retinal cells degenerate. If the macular tissue above a cyst thins to the point where the remaining tissue above that cyst ruptures, a macular hole develops. Long-standing macular edema may also result in the formation of scar-like tissue on or underneath the retina. So how does macular edema get started after a central retinal vein occlusion? One line of thinking on this question emphasizes the leakage of fluid from the retinal capillaries into the interstitial spaces of the retina. This type of swelling is called the extracellular accumulation of fluid, or vasogenic edema. After a central retinal vein occlusion, the oxygen-starved retina is thought to secrete chemicals that weaken or break down the tight junctions of the inner blood-retinal barrier at the retinal capillaries, and possibly the outer blood-retinal barrier as well. At the same time, because of the blockage in the central retinal vein, hydrostatic pressure within these retinal vessels is increased, as evidenced by the tortuous and distended veins as well as the intraretinal hemorrhages. The increase in the permeability of the capillary wall due to the breakdown of the blood-retinal barrier, when combined with the greater hydrostatic pressure present in the retinal capillaries, allows a greater outflow of water and plasma protein from the retinal capillaries into the interstitial spaces. This migration of plasma proteins and smaller solutes greatly diminishes the osmotic pull of water back into the retinal capillaries, further exacerbating the leakage of fluid into the retina. So again, looking at this with the Starling forces illustration, the breakdown of the blood-retinal barrier means that water and proteins are more free to pass through the retinal capillary wall. Increased blood pressure within the retinal capillary due to the blockage of the central retinal vein tends to force water and proteins out of the capillary. Additionally, the pulling force of the protein solutes that usually attract water back into the capillary by osmosis is reduced because the solutes are now located on both sides of the capillary wall. A second line of thinking on this question emphasizes the accumulation of fluid within neurons and later Mueller cells within the retina. This swelling of cells is called the intracellular accumulation of fluid, or cytotoxic edema. According to Dr. Bringman and fellow researchers, Normally, Mueller cells are thought to remove excess water from the inner layers of the retina. As alluded to in a separate video, solute, in particular potassium ions, are thought to lead the way for water from the retina through the Mueller cell body and into the retinal blood vessels. Potassium ion channels in the Mueller cell membrane facilitate this movement. But after a central retinal vein occlusion, the potassium ion channels located nearest to the retinal blood vessel may no longer be available. Potassium ions are still able to make their way into the Mueller cell, but are thought to be unable to pass into the retinal capillary, causing an accumulation of solute within the cell. As a result, water also accumulates within the cell. These swollen Mueller cells may account for much of the macular swelling, and if the Mueller cells subsequently degenerate, the liquid content of the cells is added to any extracellular fluid which may already be present in the retina. In regard to the cysts typically found in the inner nuclear layer, Antcliffe and fellow researchers found that at least 2 layers of the retina tend to resist the vertical movement of water in the retina more than the other layers. Those layers are the inner plexiform layer and the inner portion of the outer plexiform layer. In these layers, many types of cells make intertwining and enfolding connections which are thought to slow down the movement of water. This helps to explain the characteristic formation of cysts in the inner nuclear layer. Fluid seeps out from the retinal capillaries within the inner nuclear layer. The vertical movement of that fluid, however, is resisted by the inner and outer plexiform layers. Unable to freely move up or down, the fluid tends to accumulate within this layer. Cysts are also characteristically found in the Henle fiber layer. The Henle fiber layer is composed of Mueller cells and the elongated top portion of the photoreceptor cells. Mueller cells provide much of the structure and strength that holds the retina together. Ordinarily, these cells run vertically from the inner surface of the retina all the way down to be anchored at the midsection of the photoreceptors. Along the length of its body, the Mueller cells surround and enfold many types of neurons. In addition to this vertical span, the Mueller cells have many extensions that spread out horizontally and wrap around the various neurons and their connections. This provides the retina with elements of both horizontal and vertical strength, as Antcliffe and fellow researchers point out. But underneath the fovea, the Mueller cells, along with the elongated portion of the photoreceptor cells, are bent over. These cells spread out radially, like the spokes of a wheel, from the center of the fovea to the surrounding upper layers of the retina. After a central retinal vein occlusion, excess fluid accumulates between these fibers, causing these cells to stand up straighter. Just looking at a drawing, you can see how it might be easier for the water to make room for itself here, under the fovea, by pivoting these fibers to a standing position rather than go elsewhere in the retina and try to push up directly against the strength of the vertically oriented Mueller cells. In a slightly different perspective, Dr. Marmore focuses on the role of plasma solutes in holding extracellular water within the retina. From this perspective, where the plasma solutes get trapped or restrained or accumulate is also where the water will be retained. Dr. Marmore postulates that after plasma proteins seep out from the retinal capillaries in the inner layers of the retina, they accumulate above the external limiting membrane and also in the subretinal space above the RPE. This line of thinking may further help to explain why fluid accumulates in the Henle fibers, which are located just above the external limiting membrane, or why fluid accumulates in the subretinal space, right above the retinal pigment epithelium. To sum up then, many questions in regard to macular edema after a central retinal vein occlusion remain to be definitively answered, but from a patient's perspective there's a measure of satisfaction in what researchers have already documented and theorized. Hopefully, continued scientific discourse and future research will lead to a better understanding of the disease process and eventually translate into further innovations in treatment.